Well, let's get started, I think. And as other people join through, we'll just let them hop on. It's the beauty of a virtual town hall. We can just make it work as people show up. So thank you everyone for joining us today from wherever you are across the state of Colorado. This is a focus on Senate District 5 Town Hall, which is the Senate district that I'm lucky enough to represent, which is 7 counties in the high country of Colorado, up at the upper Arkansas Valley and western slope. And we really have a goal today of answering your questions. We have a panel of experts who have generously donated their time today to join me on this town hall to make sure that we answer any questions you come up with. Any of them that we can't answer today, we will get back to you. So you have a couple options to join and ask questions today. You can either jump in that chat box that should be on the right-hand side of your screen or wherever it may fall on your program. Feel free to type a question in there. You can also ask a question in that question and answer button that's at the bottom of your screen. We'll try to address both of those as you go along. And I know some of you were able to submit questions via the Google form before this started, and we have those ready queued up for us to all answer and get you all answers under these uncertain times. These are unprecedented times. March 4th was our first case in Colorado in Summit County. We had confirmed cases of COVID-19 quickly thereafter in a lot of the mountain communities that you all call home. By March 10th, the governor had declared a state of emergency, which then resulted in a pretty quick change of lifestyle for many of us in the high country and then the surrounding communities to follow. Some tragedy has visited the doorsteps of communities in the high country as we've lost friends and community members to COVID-19. And we've seen an immediate and significant impact to the businesses across our towns. But today we're about finding help and solutions for everyone. And so with that, I would like to give some time to each of the panelists that have joined us today to give a brief update on what things are looking like from where they sit, introduce themselves to you, and then we will go to the questions. And we'll be here together for about an hour and see how we can help support each other through this COVID-19 pandemic. So Jamie, would you like to go first? And then we'll just kind of go around the circle after that. But Jamie, right before you go, and remember all of our panelists, you'll have to mute and unmute yourselves as you go to do those questions and answers. But a lot of gratitude. The people that you're about to hear from are on the front lines of this issue, either working in the labor department or working in our healthcare industry. And so I just want to express real gratitude for what they have done and will do for our communities. Jamie, it's all yours.
Hey, I'm Joni Billesbach, and I'm the Center Director for Central Mountain Small Business Development. It's called SBDC. And we're the newest center. So we are the 15th center in Colorado in the network and just started in August and really found ourselves like everyone else in our country to have a huge pivot. We had all these programs planned, a women's leadership conference, access to money and capital, all these great capitalistic focus programs rolling out. And we had a huge pivot when our governor called the state of emergency, rightfully so, and really dove into doubling our counselors. So we had 6 counselors, and now we have 13, onboarded them. And they, along with our regular counselors, had to learn all about all these new federal funding programs. So the EIDL loan program, which is emergency disaster funding, and it comes with an EIDL advance, which is the grant I'm sure lots of you will have questions about, and then the PPP programs. But at the same time, we need to focus on what we do best, which is assist small businesses with free consulting and training programs. So we've talked and had about 200 sessions for the last 3 weeks, and have really been helping small businesses with these federal loan processes that have changed daily, and are pivoting again because those access to funding is on hold, and we'll probably talk about that today as well, to share other avenues for small businesses to survive. We have through our Colorado network, a resource list for other lending sources. I think it's about 82 other opportunities. And then our programming, because our world has changed in this unprecedented time in our small Chaffee, Park, and Lake counties, which we service, we're very focused on tourism and summer tourism at that. So our small businesses manage to get through the winter, and in the spring, that's when we have all our bookings and the money starts coming in. And instead, this pandemic came in. And so it's really been hard on our small businesses. Cash flow is very difficult now. Survival is very difficult. So our programming that we're pivoting and changing to is talking not just about financially how to get through this, which is huge, but also mindset, that the mindset of each of our small businesses and the mindset of all our customers is different. So programming to get out of our head and into our hearts, to figure out how to have the tenacity and the passion and the heart to get through these difficult times. And I can share that programming now. You can also see it on our website, which is coloradosbdc.org, or centralsbdc.org. And then our Colorado website, which Nancy, I'm sure we'll talk about as well, is coloradosbdc.org/COVID, which really showcases all the different opportunities that our network can offer, federally, state, and then in the private and public sector. And because I'm rambling now, I'm going to let Nancy back that up with all the things she does.
You want to go to me now?
That sounds great, Nancy.
Okay. So I'm Nancy Murphy with Region 10 in the West Central SBDC. For those of you who don't know, Region 10 is one of Colorado's 14 economic planning and assistance organizations. And through that, we serve seniors, businesses, and community development, and have a large broadband project that some of you may be aware of. We cover 6 counties in Senator Donovan's district, and that's Delta, Gunnison, and Hinsdale. And our Small Business Resource Center includes 2 of us. It's Dan Cinto and me, and Dan oversees the Business Loan Fund, and Region 10 also serves as a host for the West Central SBDC, Small Business Development Center, which is what I oversee. Dan and I have both been with Region 10 about 4 years, and our disaster response skills are improving because they seem to get honed on an annual basis. Last year with the potential flood threat for Lake City, and then of course this year with our with the current situation. Dan's been able to he's been able to deploy a quick response disaster loan to businesses before government programs were developed and released. So that's been a huge help to businesses. On the other side, on the SBDC side, my day-to-day work, as Jamie explained, is helping businesses stabilize operations and improve their profitability. And so we do that through offering training and consulting. For the last few weeks, we've been on the front line of the businesses through this period of uncertainty. And we've happily had the resources of the state SBDC to give us immediate contact with the SBA to understand the Small Business Administration's programs, specifically EIDL and PPP. What we're seeing is these chaotic times give way to copious distractions in businesses and a lot of unclear thinking. So we're working really hard to help calm businesses and help them think through what needs to be done and how to approach things. We're working in terms of programming on how to really address cash flow and how to leverage teams and how to connect with customers, because we think it's really important for business owners to keep their eye on the ball at this point and keep them moving in a focused and positive direction. So that's what we've got going on, and I'll hand it off to the next one.
Dr. Craig from Delta, would you like to join in?
Sure. Hi, I'm Dr. Jennifer Craig, and I am from Delta County Memorial Hospital here in Delta, Colorado. And we, similar to all the other hospitals around the state and the nation, are facing the challenges of preparing for our expected surge of COVID positive patients. And at the same time, we are dealing with shortages and frustrations that I think everybody is experiencing. Our COVID-19 testing supplies are running fairly low, and I think that is a nationwide phenomena. And I think most people are frustrated with the amount of testing that has been done and the ability to know how much coronavirus is actually in our community. I know that's a question I get asked pretty frequently by the public. We are still testing patients, but we are having to limit our testing to people who are hospitalized, who are critically ill, who are in high-risk groups such as those greater than 65 or having significant medical illness, pregnant women, or frontline workers such as law enforcement and healthcare workers. So we are having to really be judicious with our testing. I know there's going to be lots of questions about the serologic testing, which I think we'll get to later. Also, we're facing challenges of really a lower volume of patients coming through our clinics, through our hospital, because everybody is doing a good job staying home and staying safe. And that puts some financial challenges on our hospitals and our clinic systems. While we're also trying to be ready to expand greatly and utilize more resources that cost a lot more money, and be ready for the surge of patients we expect. And so there's quite a few challenges there for our facilities. We are working in Delta County with our County Emergency Operations Center during this entire time, and we have been since early March. And we continue to work every day and modify. As everybody knows, this is a real evolving situation, and recommendations change every day. So we work continuously on our surge plans with the county. We are also looking at finding facilities and outreaching to other facilities to put tier 3 and tier 4 patients. Those are lower acuity patients who may or may not have coronavirus, but just need maybe some long-term care facility or some longer-term hospitalization, but aren't acutely ill. And so we're looking for facilities around the county and places outside of there too. I think Western Colorado is all working very closely together to evaluate what resources we all have. Of course, we are able to expand into other areas of the hospital because of our decrease in elective procedures and radiology procedures. We're trying to utilize more of our hospital in our surge plans to expand our different units, such as our OB unit or our emergency department, specifically into our post-operative care unit. And of course, as an outpatient, Delta County Memorial Hospital oversees a lot of our clinics, our family practice and internal medicine clinics around the county. And we are really implementing a lot of telemedicine services and trying to still care for our community for their other medical needs in light of this pandemic. And so we're real active in trying to still make sure that we're caring for our community, that everybody's staying safe, but still being ready and planning for this surge, which we're really starting to see build in Delta County in the last week.
Thank you for that, Doctor. Joni, are you with us? I know we can't see you, but can we hear you from Gunnison, and would you like to jump in? And then Mr. Chase will go to you next.
Yeah, I'm hoping that you can see me. I apologize that you can't see me, but hope you can hear me. I am the Public Health Director and Co-Incident Commander here in Gunnison County for our COVID response here. And we're really working as a community in our response to this pandemic, including working closely with our Gunnison Valley Health System They've contributed greatly to the response, both at the community and at the incident command level. And it's been a really impressive response throughout our community as far as individuals, business owners, community members really rallying together and rallying behind the public health orders that have evolved in the last 38 days. It's hard to believe it's been just over a month since issuing the first public health orders, and we're now on our 6th amended public health orders. I've been working hard in coordinating with Hinsdale, Mineral, Chaffee, Montrose, and Delta County Public Health, and trying to coordinate the work that we're doing and keeping each other informed of the status of where we're at. As Dr. Craig said, it looks different in different communities, and so here in Gunnison, I believe that we are at the plateau and slightly declined from our peak, but we remain on a plateau and we continue to see a positive test case every day or two in our community. So we still have some cases and community spread that we would expect to see despite a flattened curve until we have some type of vaccine or community immunity. I think I'll stop there, but thank you.
Mr. Chase, why don't you jump in and then we'll finish off with Representative Roberts.
Sure. Thank you, Senator and Representative, for letting me speak today. I spoke with your constituents last week, and I remember reporting out, I think we were at that time looking at about 45,000 claims the week before that. Today we, for unemployment insurance, today we announced through our press release that last week we saw another 107,000 unemployment claims enter our system. But on the upside of that, we've also started releasing our amount of benefits paid out. So we paid out last week $62 million in benefits to Coloradans who need it most. And so that shows the system is working, we're getting claims in, and we're seeing people start requesting payment, which is great. There are still some barriers that we're working on. I know we're really hard to reach in terms of our call center. We're getting about 200,000 calls a day into that call center, so we're working on solutions to that, including large town halls with claimants and other ideas there. And then a lot of people have been asking us, when are the federal pandemic unemployment assistance benefits, $600 additional per week in benefits, when is that going live? We will be announcing the official timeline tomorrow. I can tell you now, though, it will be very soon. We're getting final word from our vendor tonight in terms of our computer system to make sure that that's live, and then we'll be able to announce that tomorrow, and we'll be able to get benefits out the door quickly on that.
Daniel, would you mind going in a little bit more on that? When you talk about vendor and new system, what happened at the state level that you guys, what was some of the technology issues you had to do? Because you basically had to redo the whole system, right?
It's not redo. We had to build a brand new system. So the Federal CARES Act essentially expanded eligibility for unemployment insurance to people who've never been eligible for unemployment before. And in order to take in those claims without the data that we normally have, we had to build a brand new system to take those in. So we were actually in a good place to do that quickly. We're going to probably be in the top 10 states to get that out the door.
Thanks. I know that was surprising news to me when everyone was asking me where those checks might be and talking to you guys about how much work you had to do even just to facilitate the distribution of money. So I know we're all anxious to get it, but I hope people appreciate the level of work that you guys had to do. Rep. Roberts, would you mind jumping in and telling us a little bit about the work that you're doing?
Yes, thank you, Senator Donovan, and thanks everybody for joining this call. It's a privilege to be with you this afternoon. Yes, I'm Dylan Roberts. For those of you that don't know, I'm the state representative for House District 26, which is Eagle County and Routt County. I live in Eagle County, and it's good to be with you today. As you all probably know, normally right now, Senator Donovan and I would be at the Capitol in Denver working right now. This would be our normal legislative session. We'd be gearing up for the last few weeks, but we are not in session right now. We suspended back on March 14th because of coronavirus, and we have stayed out of session until this point. We are tentatively going to go back to the Capitol in Denver to resume session on May 18th. We have to do a few things that are required of us every year to do by statute, which is pass the budget and the School Finance Act and a few other pieces of legislation. Any other legislation beyond that is still being decided, and we're figuring out what we can do, if anything. As you can imagine, this has taken a big hit on our state budget. And so a lot of the legislative priorities that we had going into this year are having to be modified or tabled for the time being because of that. And we want to get ready for potential legislation that can help our communities respond to this crisis. I know that both Senator Donovan and I are working on ideas and talking to all of you, because our communities, particularly Eagle County, Pitkin County, Gunnison County, have been hit very hard and first by the coronavirus. And then you combine that with our tourism-based economies that had the ski industry shut down a month and a half early, and all of the related businesses and jobs that come with that. It's been really tough time, but we are working to come up with some ideas and potential solutions in addition to what's happening at the federal level. To that extent, both Senator Donovan and I were appointed to the governor's Economic Stabilization Council that's being led by Federico Pena and a bunch of other people from both government and business and nonprofits. Particularly, I'm on the tourism subcommittee, and so we are being led by people from chambers of commerce like the Vail Valley Partnership, Visit Denver, which is the Denver Tourism Center, people from government, people from nonprofits, and trying to come up with ideas and solutions for the tourism industry. We've met a couple times so far, and we're going to be meeting a lot in the coming weeks. And basically what we're trying to do right now is gather ideas from all of you, from our businesses, from our residents, on how we could best respond and help our tourism industry. And so we, like I said, are just starting to meet. We have some preliminary ideas that I can talk about, but mostly we're trying to hear from you. So I would love to hear your thoughts and ideas either today during the town hall, or I'll put my email when we wrap up here so you can get in touch with me there. But overall message is we know it's been really hard. We're trying to connect all of our constituents to the resources they need, but we're also trying to look forward. And knowing that this is going to be a long and slow recovery, we want to try and have as much ready to go when we get back into the legislative session and beyond to help all of you. So some things are moving forward, and I'm happy to be here to talk to you about it today and take your questions.
Thanks for joining us, Representative Roberts. Really appreciate you being here today and telling us about what you're working on legislative and especially on that Government Economic Advisory Council will be really important work going forward. I'll answer a quick question we got on broadband, and then I'll throw a question Dr. Craig's way. There's a question about broadband grants, specifically talking about DMEA being able to expand their coverage area. At this time, I don't know of any specific broadband grants from the Stimulus 3 federal package. There was quite a bit of funding in that package that was directed towards infrastructure, but I know the state is still working through how they're going to use that money. And the state request right now is for flexibility so we can see how to disperse that. But I haven't heard of anything specifically that would be that would enhance the broadband deployment type grants. But we will certainly share that idea with the executive branch to make sure that they know that there's continued need for broadband expansion on the Western Slope, particularly when we talk about things like telehealth and people working from home. So appreciate that question, and appreciate you raising the need for continuing to expand high-speed broadband across the Western Slope. Dr. Craig, would you mind commenting on just germ theory, herd immunity, and its relationship to the COVID-19 pandemic?
Sure. Of course, germ theory is a theory that was developed, I think, in the 1600s and probably is the foundation of modern medicine today. And that's the idea that microorganisms that we can't actually see cause infectious disease. And so I think that's a widely accepted theory in Western medicine, and I don't know that anyone would debate that. And of course, coronavirus is one of those microorganisms that can be transmitted from animals to animals, including animals to humans, and that it is an infectious disease problem. And that's what we're seeing now, is the transmission of disease, especially from person to person. It's a particularly contagious disease for us because it's a novel virus to humans. And so much like other plagues and pandemics that have crossed our world, we just have no immunity to this virus, this particular coronavirus. And so what we are finding is that the virus tends to be higher acuity and more symptomatic in certain groups of people who have a lower immunity or ability to fight the virus. And that's why we're seeing it have such an impact on our populations in the world. As far as herd immunity is when we rely on immunity in the population in general to prevent the spread of disease. It's the foundation and the theory behind vaccination as well, is that if more people are immune to something, there's less chance that this illness can spread through our communities. And so herd immunity, and something we will eventually rely on, I believe, for coronavirus, is that a certain percentage, a high percentage of our population will eventually have this illness from mild to moderate and even severe symptoms. And then we'll carry some immunity to it. And this hopefully will prevent, when it comes through again in a seasonal way, as all coronaviruses do, when it comes to our communities again, fewer people will be infected or affected from it. And eventually it will become an illness that is like influenza, something we're used to seeing, something our bodies are more able to cope with and develop an immune response. And we'll just see lower levels of the illness in general in our communities. And I think we always need to have respect for these infectious diseases. What we've seen in recent times is they have the ability to mutate and change and adapt to our environments. And so it is important that we respect them and that we learn from this pandemic in how to respond to the next pandemic. And there probably will be another one if history is any marker of that. So herd immunity is important. And a lot of people are thinking that we need to get out there right now and develop our herd immunity, but that would just simply overwhelm our medical systems right now. So that flattening of the curve is so important in this.
Thanks for that brief medical lesson for all of us, Dr. Craig. Daniel, a question for you. There's a couple questions about these checks that are now coming through as part of the stimulus package. Some of them are getting intercepted by various entities. Are you able to comment on who can intercept those checks? And if you know any background on that process, or if not, that might be something we can chase down.
Yeah, I can comment only a little bit in terms of what is generally something that the government can essentially take those kind of monies back for, which would be something like child support payments or anything that, let's say, delinquent taxes, things like that might be collected upon, assuming the IRS stimulus checks would be in the same category as that.
Thanks for that. Whoever asked that question, if you need further details, maybe email myself or Representative Roberts, and we can follow up on that. Quite a bit of questions, and maybe whoever can jump on this answer that wants to, but quite a bit of questions on what are we doing to get the needed PPE and ventilators to our local hospitals? Has there been attempts to speed up treatment and some of those supplies productions? Actually, a couple different questions on if we've reached out to President Trump. I can answer that, and then I think Dr. Craig, we may go back to you because I think Joni had to jump off this call for another emergency call she got down in Gunnison. So we're going to rely heavily on you on the healthcare questions. But in regards to our advocacy at the state level, and Rep. Roberts, you can jump in on this as well. We've been working closely with the governor's office to share the concerns of our constituents. And I'll just briefly talk about, Rep. Roberts, you can jump in. what was interesting about how this pandemic came into Colorado is it really kind of emerged in the high country first. This was, of course, a blessing and a curse because we have been impacted by it longer and more significantly in terms of like a per capita basis. But what we were able to do in a lot of ways is get a lot of issues addressed and quickly raised to the top before it hit some of the bigger population areas. So even though unfortunately we of course did see some people lose their lives to this, we were also able to really serve a purpose of elevating a lot of issues in smaller population centers. And so when COVID-19 started spreading to the more populous areas of the state, we were a little bit more prepared. Rep. Roberts, would you like to say anything about our state efforts and any advocacy with our congressional folks?
Yeah, absolutely. I agree with what Senator Donovan said. I think we've been able to highlight the impact that this has had on our mountain communities and communities along the Western Slope and rural Colorado more generally. We've been our federal partners have been very helpful in this regard. This is our congressmen, our congresswomen, our senators in the administration. I think the CARES Act that was passed a couple weeks ago has some significant resources in it that are being dispersed now or will be dispersed soon for both individuals and businesses. What we're going to look for at the state level in particular is Colorado is slated to get about $2.2 billion directly that can be used to help shore up local budgets and state budgets. And what we need to do and what we're going to do as state legislators is work with the governor to make sure that our smaller communities get their fair share of money, because there's a provision in the CARES Act that says communities that are 500,000 people or more are going to get a first bite at that apple. And unfortunately, the smaller communities don't necessarily get dedicated allocations. So we need to work closely with the governor, and I think we'll be able to do so to make sure that communities across the states, regardless of size, get the aid that they need so that they can shore up their municipal budgets and then help their local businesses and residents.
Thanks, Rep. Roberts. Dr. Craig, would you mind commenting on if it's just Delta or some of the other hospitals you're working on, the general level of preparedness and where we are on our supply chains and all that?
Sure. I've been working with emergency departments and hospitals around the state. We have a Monday evening meeting that has been very interesting. And I would say that really Colorado hospitals in general have been very proactive. A lot of us have had, unlike a lot of the high country, have had some time to prepare for this instead of having it kind of thrown upon us. And I believe that we are in a great situation where we have been able to coordinate and learn from states like Washington and New York and really be prepared. I know that St. Mary's in Grand Junction is having some pretty remarkable outcomes with their coronavirus patients. And so we really are prepared, and we're learning. This is a constant changing scenario, and I think we're all learning together about this. As far as supply chains, that's just very difficult. Unfortunately, what we're realizing is so many of our supplies do not come from, are not domestic. We get a lot of our supplies internationally. This whole coronavirus has put a strain on the medical system globally, not just nationally. And so there's need for things like medications, sedatives, ventilators, testing supplies internationally, and these companies are just having a hard time keeping up. Plus, we're actively developing new tests and new innovations. I think, necessity generates invention, and we're seeing that testing is being developed, and we have a lot of people who are being very innovative, and I think even in the state, we're seeing a lot of really interesting things happen, but we're starting from a point where we're playing catch up instead of being ahead of the curve on some of these technologies and new testing. So we're working hard on it. We're trying to be conservative in all ways that we can, but and we are all aware of those shortages and just doing the best we can with what we have.
Nancy or Jamie, a couple questions coming your way. We got a question, and it I assume they're talking about the PPP program, but I'm not sure. But it says applications for loans and grants have been suspended according to today's messages. Will there be additional funds? Oh, Jamie, I think we're still on mute.
Sorry, I'll start and then I'm sure Nancy can chime in. The federal funding has been challenging because if you think about it, the federal government has been prepared for disasters regionally. And so the federal funding, when they allowed it to open the gates and start having disaster loans, there was no national system. So there's been lots of challenges that each of us individually and as support groups have faced, as well as all the SBA and federal staffs that are trying to manage this that can't handle the volume. So today we had the call that both the PPP and the EIDL loans have run out of funding. And we'll talk about this from a small business perspective, but I hope Senator Donovan, you could talk to about the legislation side of this. So what's happened is there's funding that we're waiting kind of in new legislation to fund these programs. We went through $350 billion in PP funds in 14 days. And there's still many applications that haven't even been processed through the 7A lending sources. So the people that have been contacted, that have been told that you are receiving this loan through their lender, will be getting the funding, but they are correct. Applications are on hold through the federal government. It's a mandate that they cannot take applications when the funding is no longer in place. So that is a huge small business challenge and a legislation challenge that I hope we can talk about. And then the EIDL loan is also running out of funds or has run out of funds. And I don't know, Nancy, since I've talked so much, if you're able to kind of talk about that one.
Well, it's my understanding that the EIDL portal has been closed at this point, and they will not take any more applications for EIDL or EIDL Advance until more money is appropriated to that program or a similar program. I did see also on the chat thing that someone asked about any programs for lost revenue, and I haven't heard about that. I think it's really important to understand that all of these programs, the PPP, EIDL, and any regional loan funds that are out there do not cover projected revenues or lost sales. They also don't cover expansion.
Thanks for that. Dr. Craig, there's a couple of questions about testing, and I know you briefly mentioned it, but maybe you could expand a little bit on what we think the future of testing is. And there was a mention of an Abbott test, if that's a question you could address as well.
I can't give specific numbers as to who has how many tests, and there are a lot of independent companies that are buying these tests and able to provide some testing, and I can't speak to the numbers of those in our state, but I will tell you that there are two different types of tests. We have a PCR test, which is what is being utilized by the CDPHE, the health department. And that is a test that is a positive negative test for acute illness. So people who are acutely ill, we are doing a nasal swab on them, and we are just testing for the presence of RNA from this virus in those swabs. The other type of testing, and the Abbott one that is being asked about, is a serologic test, meaning we are testing for the presence of antibodies to coronavirus 19 in the serum. And that would indicate that there has been infection and that the person has had an immune response to it. That becomes really pertinent about epidemiology and the studies of how this has gone through our community. Who has developed immunity and maybe been asymptomatic or had mild disease, and what we can expect when we all start doing business as usual eventually soon, and what kind of resurgence we should expect. Those tests are going to be quite useful in the future, but right now they're fairly limited. There are multiple people, not just Abbott, that are developing these tests. And this is actually, if anyone's aware of the testing that went in on San Miguel, in San Miguel County, that is the testing they were using. And that was an independent company doing those testing. So there's a lot of people looking at this question. It will become very pertinent as we face the future with this virus. And eventually it will be also available. But right now, although the test is there, getting the supplies, the testing, the reagents, and the machinery to do the testing is the challenge, not that the test is present. So again, these companies are ramping up production, but we're just not at those levels where it's a very viable testing option for us yet.
Thanks. Daniel, quite a few questions around unemployment, who can apply, who can't, who's eligible, kind of where to go if there's problems. Could you just give maybe a broad overview of unemployment as it stands right now?
Sure, be happy to. So I like to bifurcate it into the two separate buckets. So number one is the regular unemployment insurance, which is just through the state. And so that is something that you might be looking toward if you're maybe you're a W-2 employee, you got laid off either permanently or a temporary furlough, or just hours reduced. If you saw your hours reduced, that's going to be where you're going to look to apply for unemployment insurance. We'll look at things like how much wages have you made in the last 18 months, and a few other circumstances to see if you qualify under that. It's always a case by case, so it's hard to give too detailed on that. But generally, people who are being furloughed or laid off, they're going to qualify for unemployment under that. The other bucket is going to be what I had mentioned in terms of the pandemic unemployment assistance through the CARES Act. That's what we're going to announce tomorrow in terms of the timeline on when to apply. But people who would qualify for that are going to be people like either independent contractors, gig workers. Maybe you own your own business and you weren't paying into unemployment insurance for yourself. You may qualify under that. That's also going to help people like if you're a student, maybe you were expecting a job this summer that you're not going to be able to go to because of the COVID pandemic. You may be able to qualify for the unemployment insurance under that program. In terms of things like the process and how that might work, in terms of regular, you'll go online and file. The best thing to do right now is be very careful as you're filing online. As I said earlier, it's really hard to get a hold of us right now. We are aware of that. And the best thing to do is try to limit the number of cases where you are going to have to call us to make a correction to your claim. If you do everything online, you do it all right, you're gonna be able to see payment probably within 2 weeks. You'll see your first payment. And so that's kind of that process. We're part of the reason we've taken a little bit longer on the federal side is our goal is to actually, with the new system that we're building, make it so that once you file your first and initial claim, you're going to see payment very quickly. You're going to be able to see payment hopefully within a week after filing. That's our goal right now. And so that's kind of the overview of the process. Happy to answer any other questions around that as well.
Thanks. Rep. Roberts, a few questions on the governor's stay-at-home order, what that means for the mountains, if there's a consideration of possibly extending it. Could you comment on that?
Yeah, absolutely. So I'm sure most people are aware on this call that the current stay-at-home order as issued by the governor that applies across the state goes until April 26th, which is next week. The governor said in his press conference yesterday, which is the latest that he's talked about it on the record, I believe, is that we're still on track for lifting that stay-at-home order on April 26th. There's no guarantee that it will be lifted on April 26th. I think he is going to be consulting all of his experts and his team as to whether it's safe to do that. But another thing that he did make clear, and I think we're starting to see this both in Colorado and across the country, is that just because we lift stay-at-home orders it's not flipping on a switch. You know, we go right back to normal. It's going to be to some extent, social distancing is going to be continuing for quite some time, and we're not going to go back to normal, but we're going to go to a new normal. I believe that we in the mountains want to open up our businesses and get back to the community events that we care about a lot as soon as possible. But, you know, in Eagle County, for instance, there was an article in the Vail Daily a couple days ago, I'll put it in the chat, that talks about how the county officials are working with businesses and event centers to figure out how we can continue some of our summer activities this summer with new rules in place about distancing and, you know, removing tables from restaurants so there's more space between, you know, yourself and the other table that's next to you, or making changes to business practices about face masks and things like that. So specifically to the question of the governor's stay-at-home order, no reason to think it's not going to be lifted on April 26th as of this point, but you know, I've seen other states just today. New York announced that they're extending theirs until May 15th. So I would just stay tuned to the governor's press conferences. He seems to have them every other day. But as of yesterday, his most recent one, he says we're still on track, but just with the caveat that we're not going back to normal on April 27th. It will be a different type of normal.
And I think too, since we're talking to such a broad swath of the state right now, there could be different rules put out by your county. So I think it's important to double check that your local regulations, what the status of those are as well. I also got a message that I think is actually important to share, to remind people to check with your county or local jurisdictions on outdoor recreation laws and requirements. We're seeing a lot of crowding at trailheads. We're seeing a lot of people go into the backcountry, which actually Colorado Search and Rescue has respectfully requested people to not put pressure on them to rescue people from unnecessary recreational activities right now. So I think it's just important now. It is hard to think about spending another day in your living room, but it is just so critical now that we adhere to these temporary restrictions for the long-term health of our community and our neighbors. And I think it's important to think that really the life that you may be saving is your own, because this is an unseeable threat that you're trying to avoid and keep from transmitting. Would Jamie or Nancy be able to address the full-time equivalency definition aspect of PPP? Even though I know those programs, it sounds like those are temporarily stalled. I believe we will get more funding for those, which was another question that came in, are we in line for new funding? The conversations that I'm hearing from our congressional delegation is there will be in the stimulus 4 package or as standalone bills, more money in those two programs for small businesses. So what is full-time equivalency mean in the PPP program?
It's my understanding, it's a little bit unclear, is my understanding. I don't think that they've given us full guidelines on that, but what I understand them to do is to compare to last year's payroll and how many full-time people were on that, and they compare this year's to that to figure out what the full-time equivalent is for the business. Jamie, how about you? Do you understand it that way? Turn on your microphone.
I'm trying. I have Zoom issues. Anyway, yes, I understand what Nancy's saying, and what that means is from last year, how many full-time equivalent people you have that you're able to sustain that going forward for the 8-week period that you're funded for. And it doesn't need to be the same full-time people that worked last year, but at least those full-time hours.
Wonderful. Thanks for that. And of course, we will also keep populating this chat line and then newsletters and online with further resources because there are some really good resources online that these state entities and medical professionals that are working to support citizens across Colorado have consolidated. If you're not on Rep. Roberts or my newsletter or social media, that's where we're really pushing out as much information because as many people have said, these things are changing day to day. So we're really trying to actively keep that information being pushed out. So with that, I wanted to just go around to our panelists and let each of you wrap up with closing thoughts, with the one thing you forgot to mention at that question 20 minutes ago, maybe one last resource or idea to share with everyone who has joined us this afternoon. So Dr. Craig, do you mind going first?
Sure. So really, I want to reassure everybody that what we're doing is working. We are flattening the curve in Colorado, and I think we're seeing that by people recovering more quickly. We're also seeing our numbers recover in the hospitals, and we're hitting those lower peaks. We're not having near the height of surge that we've seen in other states. And so I really appreciate everybody doing their due diligence at staying at home and practicing social distancing, washing your hands. Those are the things. There's lots of people asking how they can help, and that is a way that you are helping. And so I want to encourage you and let you know that it is working, and we do acknowledge that we need to get back to work and get back to business as usual, but we want to do it in a safe way. And so I urge you to be patient and continue to follow the stay-at-home orders, practice your social distancing, be careful if you're sick. I also really want to thank, as far as Delta County, and I'm guessing this is probably common in Western Colorado, our community response has been amazing here in Delta County. We have received so much donated PPE, and we've had people sewing masks for us and just reaching out and volunteering, people bringing food to our hospital and essential workers. And I'm just so impressed by our community response. And when I talk to these other groups in other areas, that's just not always true. So I'm very appreciative of where we live and everybody's time and effort in all of this. And I think that the rest of my coworkers feel the same way. And I'm certainly very appreciative of them and their response. People are dedicating so many time, are donating time and a lot of hours and a lot of brain power to this issue. And you have a lot of good people working on it. So we appreciate all of you, including this whole panel. So thank you very much.
Thanks, Dr. Craig, for joining us this morning. I know when we did our chest run this morning, you were in your scrub, so we know you're putting in the long hours for us, and we really appreciate that. Jamie, would you like to jump in next?
Sure. I think it's been great for me working in Park Lake and Chaffee County that how all the county commissioners are getting together and trying to decide how we work to reopen, and I know that involves Nancy's region as well and in Gunnison. I think there's also a responsibility for small businesses. We urgently need funding and visitors to come back, but there is a new normal that's going to need to occur on how we welcome people back to our areas. And so a whole mindset shift from how we used to do business to the new way of doing business. And how we can renew those balances so that we can recover as opposed to just starting business as usual, that it really is a whole new model of business. And that's where SBDC centers can help.
Daniel, you want to go? Good wrap up from CDLE.
Sure. As I mentioned earlier, we are seeing an unprecedented number of claims into our system, but the good news is most of those are getting through and they're getting paid out to people who really need that money, and we know how important that is for all the folks out there that are applying. We're really looking forward to hopefully very early next week to start applying that additional $600 weekly benefit to all UI claimants. That should be done automatically to anyone who's currently on file. And as I said, we're working quickly to fix all the accessibility issues that we've had in terms of our call center, and we are prepared to continue paying out benefits as long as this might last, to make sure that people stay whole through this very difficult time.
Nancy, final thoughts from you.
I'd like to echo that I think it's been remarkable of how the communities have come together to provide all the resources and information to people. That's been really exciting to see. A few things that I'd like to leave you with is I've put in the chat some business resources that I'll hit send on in just a minute. But just so you all know, a great place for business resources is the coloradosbdc.org. They're sort of the clearinghouse of all information for businesses. If you want to know anything about any of these SBA programs, it's important to go directly to the sba.gov website, because they're the ones who are responsible for developing and implementing these programs. And then, of course, just to remind you, please reach out to Jamie and or me at West Central SBDC or Central Mountain SBDC if you or a business you know could use some help, some consulting, or some training, because that's what we're here to do. Thanks.
Thank you for that. Representative Roberts.
Thank you. Thanks everybody for taking the time to join us this afternoon. I hope it was helpful to get the conversation started. I'll echo the offer to get in touch with myself if you have any questions, input, if we can connect you. Since we're not in session at the legislature, I see my job as a legislator representing Eagle County and my constituents is a conduit to get you the resources you need, to get the questions answered that you have, and to try and help as much as possible connect you to the right people, because there are so many great people and resources out there, and the communities coming together. I could not agree more. Unfortunately, we got hit hard in the mountains and across rural Colorado, but if somebody had to be first and get hit hardest, I know that we're the strongest and we have the strongest communities to build our way out of it. So I'm confident that we will. I'm excited about the governor's task force, the economic task force. If you have ideas specific to tourism or outdoor recreation, get in touch with Senator Donovan and myself. And just want to say thank you. And I know this is such a hard thing for people. This is just really challenging and obviously unprecedented. And I'm sorry for everybody who's been so impacted, either health-wise or economically. This is just a huge hit. There's no way around it. But we're here to help as much as possible, and so use us as a resource. And just thanks, Senator Donovan, for allowing me to join. And I hope to hear from all of you soon.
Thanks for that, Representative Roberts, and thanks for all the work you're doing on behalf of all of us with that Governor's Economic Stabilization Council. That'll be important work going forward. Thank you, everyone who joined today. Between Facebook and Zoom, we had about 100 people join us. So we really appreciate you guys finding the time to seek out these answers too. I think up in the Western Slope and the mountain communities, I know we have a tendency to think we should pull ourselves up by our own bootstraps. We're not always the first ones who reach out for help. That spirit of the West, that rugged individualism, doesn't always lend itself for asking for help. But I think right now is an important time to make sure that you're availing yourself of all the resources you can. And we will continue to push those out. Everything from Colorado Mountain College offering free tuition this summer. A lot of mental health centers are offering free telehealth support. There are hotlines that you can call. There are loans and grants available. There are some that might just be for bartenders. There are some that are just for small businesses. There is an effort in Colorado on the private side to build a fund different. So as Dr. Craig said, these communities are really coming together to help each other in little ways. So make sure you're reaching out to those that you love and connecting with them, but also make sure that you're taking advantage of these huge federal programs as well. So from the tiny to the huge, look for ways to support you and yours, and we will get through this together. So again, much appreciation for the panelists who joined together You guys shared a lot of knowledge today. I learned a lot. And please continue to reach out to Representative Roberts and myself. Other folks have put their contact info in that chat box. We will share this online as well. We also did record this, so we will share that so you can review it for other questions, or other people can use the resources we did today. So with that, we will say goodbye. Take care of yourself. Have a good Friday and a good weekend, even though all the days blend together right now. Take care, everyone.